11:43. Welcome back here on the Midday Show. Here in the United States, about 2 to 3% of children have scoliosis, which is around 3 million new cases every year. That is according to Children's Healthcare of Atlanta. And while we do not know the exact cause of scoliosis in most adolescents, there are some ways to treat it. And that is why we have Dr. Chad Ahrens here with us from Bon Secours Tuckahoe Orthopedics. Thank you for being here with us today. So talk to us a little bit about yourself, what you do, and how you're involved in all this as well.
Sure. Thanks for having me. I'm a pediatric orthopedic surgeon, and so we see lots of kids who have scoliosis, as well as other medical conditions, and so here to discuss it today.
And so talk to me, I mean, what, for the average person who doesn't understand what scoliosis is, what is it, and then often, how common is it in children?
Sure. So scoliosis is an abnormal curvature of the spine, and although some people refer to it as being S or C-shaped, think of it more three-dimensional, like a spiral staircase, right? Okay. It goes side to side, but also twists at the same time. And as you mentioned, we see it about 2% of the population in kids, so about 2 out of every 100 kids will be diagnosed with scoliosis.
Oh, wow. So then talk to me, too, about how is, what are some common signs? What should a parent be looking out for in these early stages for a red flag to maybe come see you guys?
Sure. So, well, scoliosis is not painful, so that is one thing that you won't see. But more commonly, you'll see a little curvature or a little prominence on their back. If you remember, I know when I was a kid, they would do the bend forward test where you'd put your hands together and bend forward, and the nurse would look at your back. And this is generally done at pediatricians' offices, but we'll have parents that sometimes will notice it on their own as well.
And then how does diagnosis go for this? I mean, is it just that kind of a test, or are there other tests as well?
Yes, that's usually the first step. And then we'll see them in the office and take an X-ray to confirm diagnosis and look on an X-ray what degree the patient or student has.
And what age should we really start to be talking about this? I mean, what's that kind of range?
Yeah, so the majority of children are diagnosed during adolescence. However, we do have early onset in newborns, and we have juvenile scoliosis as well. Although, like I said, the vast majority are adolescent.
So then talk to me also about treatment options here for children with scoliosis, and how do you decide at the end of the day what is the best approach based off every family and the child's condition? Yeah,
so as we talked about earlier, once we get that X-ray, we'll be able to measure the actual degrees that patient has. And depending on the degree that they have, kind of guides our treatment. So if we have curves that, first of all, anything more than a 10-degree curve is actually called scoliosis. Okay. Below that is technically normal. Between 10 and 25 degrees, where most people will fall, no treatment is needed. We just observe and watch them as they grow. Okay. Growth is what actually will cause any change in the scoliosis. And so for the vast majority, we just take an X-ray every 6 months. For those who have curves between 25 and 45 degrees, we can do a brace just like this one. Okay. Okay. And that will help prevent the progression of scoliosis. And then for those who unfortunately who have curves over 45 degrees, sometimes we'll have to put rods and screws in their back in order to pull them straight and prevent further progression and problems in the future.
I mean, are you more commonly doing more stuff like this, or is it more correct, are we using more of these braces?
Yeah, by far the most common is just observation, and then the second most common is the brace, again, preventing the need for surgery. So it's very few people at this point that actually need surgery for scoliosis.
Gotcha. And then talk to me about advances in treatment for pediatric scoliosis, and how do younger patients benefit from those advances that you all are making in the field?
Sure. So first off, we now have a low radiation X-ray called an EOS X-ray. It's about 80% less radiation. So for those kids that we're observing, let's say they're diagnosed at 9, and we're going to follow them until they're done growing, to have an X-ray every 6 months, this gives us an opportunity to decrease the amount of radiation that they're receiving throughout the time. The second thing is, in those children that are very young, we don't want to fuse their spine if they have curves over 45 degrees when we know that they're going to continue to grow. So we have a growing option where we actually expand the rod in the office with a magnet every 3 months, and that allows them to grow. And then the fourth is, third option, I don't know why I said fourth, is that we have a robotic spine surgery, making it A, more accurate, and B, less radiation to both myself and everybody else in the operating room.
Definitely.
So, yeah, some good advances that we utilize to take care of these kids.
Well, all very important information, and we thank you definitely for coming in and talking about
Absolutely.
it.
Thanks for having me.
Chad Ahrens with Bon Secours Tuckahoe Orthopedics. Thank you so much for talking about this today.
Thanks for having me.
Time now for